Welcome back. In our previous use case demonstration, the patient created a consent directive authorizing sharing of all information to a specific set of providers for purpose of treatment. In this use case, share partial, the patient wishes to redact all findings of past substance abuse and mental health related issues. Additionally, the patient authorizes the release of all HIV findings to a specific group of providers. Dr. Leo, working at a mental health organization, legally constrained by 42 CFR Part 2, will now log in to his EHR and select our test patient. We note that our test patient is currently on an antidepressant, has acute HIV and substance abuse disorder. Dr. Leo wishes to refer this patient to Dr. Duane at Veterans Affairs for a consult. Dr. Leo will also be sending the patient's summary of episode note to Dr. Duane via direct. We have added additional and optional capabilities to allow Dr. Leo to review the tagged or annotated C32 prior to its release to Dr. Duane at the VA. Dr. Leo clicks on the Approve Document Before Sending button. At this time, the following will occur. An authorization event occurs blending both patient consent and organizational policy to determine if the recipient is authorized to receive our test patient's data. Additionally, obligations for handling and annotations are returned based on the patient's wishes, organizational policy, and jurisdictional constraints. The summary of the episode note is tagged and annotated and presented to Dr. Leo prior to his release to Dr. Duane. Dr. Leo approves the resultant C32 for delivery. Now let's take a look at what occurred in more detail. An Xacamo request was generated, including the recipient's credentials, organization, purpose of use, the test patient's authorization, and any organizational constraints. The policy decision point returned a permit. Additionally, obligations including document handling instructions and tagging information were also returned, including 42 CFR Part 2, no redisclosure, the redaction requirement of substance abuse and mental health related findings, as well as the masking requirement of HIV. The document orchestrator requests all tagging annotation rules from the security labeling service. An example rule for the redaction of a specific antidepressant is shown. The rules and the decomposed C32 are passed to the rules engine. The rules engine has determined that 3 clinical observations must be acted on. Document transformation. First, the original C32 is decomposed into clinical facts and sent to the rules engine. Observations requiring removal are redacted. Note that the substance abuse and mental health related information has been removed. Tagging the document for confidentiality and sensitivity at the document, section, and entry level then occurs. Masking or encryption of specific observations for the recipient's eyes only is then accomplished. Note that HIV has been masked. The entire document is then encrypted and bundled into an XDM package. Receiving and processing the XDM package. Dr. Duane at the VA will now log in to his secure email service and receive the message containing our test patient's clinical summary of episode note, C32, from Dr. Leo for further processing. We are using Health Vault for demonstration purposes. Dr. Duane will save the XDM package to his desktop. Dr. Duane will not be able to view the contents of the XDM package until it has been processed by our access control system. Dr. Duane then drags the XDM attachment onto the direct document processing icon, where the package will be unzipped and metadata will be evaluated to determine if Dr. Duane has the necessary credentials. Let's look at what permissions or privileges Dr. Duane currently is asserting. His home organization is the Department of Veterans Affairs. His structured role is MD Allopath, and his current purpose of use is treatment. He has permissions to resources for receiving, collecting, viewing, and possibly redisclosing NHIN direct information. Additionally, Dr. Duane has sensitivity privileges for substance abuse, mental health, and HIV. Let's look at the access control decisions occurring at the VA. When receiving and unpackaging the XDM attachment, Dr. Duane asserts his credentials and permissions. Metadata about the patient and the information contained is not available at this time, only organizational policy. In this case, Dr. Duane is required to assert the NHIN direct receive permission. The next step in the processing is the collection phase. Again, Dr. Duane will assert his credentials and permissions. Metadata is available at this time, where the intended recipient, purpose of use, additional handling instructions such as no collection, encryption at rest, and so on are available for processing in the access control decision. Metadata associated with our test patient's clinical summary of episode note has now been persisted and available for evaluation when Dr. Duane attempts to view or redisclose the document. Intended recipient, intended purpose of use, redisclosure requirements of 42CFRPart2, the evaluation of confidentiality and sensitivity are now part of the access control decision requirements. The following examples demonstrate the 42CFRPart2 no redisclosure warning when attempting to view as well as redisclose the document. In our next example, we will change Dr. Duane's purpose of use to research. Dr. Duane will be denied as the intended purpose of use the document was released on was treatment. This ends our demonstration of data segmentation for privacy, share partial.